What are med students like? So I'm currently a medical student, so I'm around medical students. My wife is a medical student, so she's around medical students. And I went to university before medical university, and I was around kids who wanted to be medical students, so they were studying, as they like to call it, pre-med. It's like you pretend like you're interested in science, but it's purely to get into medical school and you really don't care at all about science. Now, I love science, but the pre-med students, they're not into science. They're just into remembering the stuff for med school. So I guess that's a good place to start off on. Most pre-med students do not have an interest in science. Now, that doesn't mean that they have no interest whatsoever, but I mean no real interest. Like, they might have a surface interest. Oh, cancer seems interesting. I'm interested in cancer. Or, oh yeah, drugs are cool. It's interesting how they can change what the body does. Just very surface level interest. Never actually read medical studies, never done any research, never done any experiments themselves, never tried to put themselves in a situation where they could learn more about the human body or science or whatever it is. Just very general interest. These people tend to be very... Now, in the pre-med level, a good amount of them are people that are very... I'm at lack of words here. They're not very well-rounded people. Oftentimes. I'm not going to say generally, but very often they are not well-rounded people. Probably generally, but I can't say that for sure. Because what seems like most of them are very focused on school. Now, not all of them, but who knows how many of the ones that aren't as focused end up getting into medical school. But these are people that their life revolves around school. They're not so much into sports or anything else. In other words, they don't tend to have much of any hobbies. They might, but what seems like most of them, and by most I'm thinking like 60-70%, don't really have any hobbies. Probably they have some interests, but they don't seem to really have strong interests. These are people that just mostly focus on school, and then they watch some TV to relax, and then they focus on school. It leads to a very underdeveloped person. Now, you take these people, the ones that stick with that lifestyle, and the ones who did that lifestyle enough to get into medical school, and I think the same actually applies in large to PhD students as well. I've noticed that PhD students tend to be very emotionally underdeveloped, and just underdeveloped in general. Just school, study their particular thing, not necessarily in an intelligent manner, although hopefully later on PhD students do gain an interest in actual scientific method rather than just memorizing things. But they still tend to be very underdeveloped people with emotional problems, and yeah, they've got issues. Now, I've met some that are like cool, normal, nice people, but a lot of them, like I said, underdeveloped people. And the same applies for medical students. They are people who, just focus on school. They don't really have a life. It's not because medical school is so challenging. Now, it might be for them due to their low level of intelligence. Oh, what do you mean? Medical students can't have low level of intelligence? Well, actually, they really can. Because if instead of having a normal life and going to medical school, you just skip the life part and all you do all day is try to remember all this stuff. You don't worry about comprehending anything or getting anything useful out of courses. You just focus on being able to recite back to the professor what they want to hear. And that's what the majority of medical students do. Not to be repetitive, but they're very underdeveloped, like not well-rounded, emotionally underdeveloped, very anxious, on edge. Really, you would think that you're back in like 5th grade with kids on drugs. Like, I don't mean normally in 5th grade that kids are on drugs. I mean, imagine like a 5th grade classroom, but like give the kids some sort of drug that makes them like really anxious and aggressive. Who knows, man? It's because the medical students are on speed, aka Adderall. Not saying any of the ones here are, but in case you didn't know, most medical students are taking amphetamine, speed, Adderall, or Ritalin, or some other psychostimulant similar to amphetamine. Methamphetamine has a stigma attached to it. I know that when I was younger, the kids that used amphetamine would not touch methamphetamine because, like, they are different drugs, although they're similar enough that you could substitute your amphetamine for methamphetamine at the correct dosage, but they like to stick to their pills and they don't like to buy meth. But they're still taking drugs, and it's not the point of this video. And I don't think that's the actual reason why medical students are so on edge and jumpy and aggressive and anxious. I think it's just because they're really struggling. They have no life. They tend to look more unhealthy as the year goes on. A lot of them will gain weight. Skin gets worse. But the most pronounced thing is the like aggressive on edge attitude. And they have, sadly, they're very, instead of trying to find a word for it, I'll just explain it. They will do whatever they can to make things easier on themselves. Now that sounds intelligent. You know you should try to make things easier on yourselves while screwing over everyone else. You would think that an intelligent group of people, sadly it's not an intelligent group of people, as I explained, just people who dedicate themselves to memorizing and being able to recite. But in an intelligent group of people, in a difficult situation, not that medical school is that difficult, but let's assume that it is difficult, an intelligent group of people would work together to make it as easy as possible. Because inherently, if you try to screw each other, like, it's not that you're trying to screw each other over, but they end up screwing each other over because they're all only thinking about themselves right now. What's gonna help me right now? And by the way, when I say all this stuff, I'm not talking about myself. It's not that I think I'm so much greater, just I am a little bit unusual, a lot unusual. I'm nothing like my classmates, I'm nothing like most university people. I'm nothing like most people in general. But yeah, they're always thinking, me. And it's really like, it's like they have mental problems. And they also have this strategy and mentality of victimhood and complaining. It's always, oh, but you don't understand. Like, they're always bitching and whining. And they're just persistent. Like, if a professor says, I'm just pulling a recent example, oh, sorry, we can't move the test back by one day because I'm busy with a different class that day. Students will just keep asking, and the professor already explained that I can't do it that day because I have a different class, like for the whole day. I don't remember exactly what it was, but the professor couldn't come that day. The students just keep asking and asking and asking and asking, and then they think they're real clever. But when they come up, it was something that makes no difference whatsoever. And eventually the professor just has to walk out because like the students aren't going to like engage in intelligent conversation with the professor. They're just going to keep begging and asking. In this particular example, they weren't begging, they were trying to come up with clever ways to convince the professor that she's not actually busy with the class. Trust me, the logic these students use should make you afraid to go to the doctor. Examples of how pathetic they are, how little they actually know, and how they're always willing to screw over other students. So in my group, there's currently 9 students. 6 of them got nursing degrees, and some of those 6 also worked as nurses for some amount of time. The other 3 of us had science degrees. So me and 2 other students had to do, well, still have to do, it's not necessarily nursing class, they're just like medical practical skills classes, and the nursing students don't have to do them. For example, I'm not exempt from them even though I've done pretty much all the stuff, if not all of the stuff. And I was not exempt from the science classes, but that's not the point of this video, that for some reason the science students have to do way more work than the nursing students. So yes, the nursing students would finish class at 12:30 in the afternoon. Me and the 2 other students would finish class at 6, but we had to go to a different part of the city, and then it would take us like 50 minutes to come home in traffic, so we get home at like 7, and there is a difference between getting home at like 12:45, 12:50 after a few hours of class, you're nice and fresh, you're feeling good, versus you get home at 7 after starting class at 8. So you've had a long day. It's not like an impossibly long day, but it's a significant difference. So me and the 2 other students asked if we could move a test, not a final exam, but a test, from a Friday to a Monday. Now the professor said that would be absolutely fine. However, the other 6 students had an objection. What would their objection be? You would think they wouldn't mind the extra time to study for this test, but their objection was that they would forget the material over the weekend. Because they know it so well, and because there's this weird ban on studying over the weekend, they would forget it all. And before they said this, before they said it so explicitly, I was like, you don't have, they complained that they would have to study for this test over the weekend instead of for the test the next week. I explained to them that if you already know this stuff, you actually don't have to study this stuff over this weekend. You can study exactly what you were going to study for the next week, as if we already had the test. And if you already know the stuff for this test, you'll do just fine on Monday. But, nope. They cared to do despite the fact that these grades don't really matter, like they matter if you pass or fail. And when you're very busy, it's a lot harder to pass. Now, I ended up doing far more than passing. But somewhat of a decent example to show how the students, for example, they like didn't care that we had like no time to study. I know we had time to study, but we did have other coursework, and it's not like we got home and we could only just study for this. Not the worst example, not the best example of the worst way students can be towards each other. And it's hard to think of examples because really I don't pay that much attention. But to get out of the example mode and get back to just describing them, anything they can do to make it easier on themselves, regardless of how it affects the other students, they do. The only issue with that is when everybody's doing it, and I'm not talking about my 3 versus the other 6. I mean everybody with everybody. Someone may be like good friends one day, and then the next day they're screwing each other over because it suits them better. And then they go to working together, then they screw somebody. Personally, I'm always like, this doesn't hurt me, and it helps you, so I'm okay with it. And if something like hurts me a little bit, but it helps everybody else, sure. Other people, doesn't matter how little it's gonna negatively affect them, they only think about themselves. And at the end of the day, it's gonna end up coming back to hurt them because everybody's doing it to each other. So yeah, on edge, I forgot about that part, really. And it's amazing how ironic it is and how one-sided they think. It comes back to the only thinking about themselves part. For example, today in anatomy class, when the professor is showing a specimen, and I'm standing, apparently I took the spot but I did not take her, I was there before her, but apparently she owns the spot closest to the professor to videotape. Other students have expressed to me that they have spots before. Like one time, I went and I sat down in a classroom, and a girl comes later, and she's yelling at me how that's her spot. I said, no, it's not. You don't own this chair. But being the better person, and probably shouldn't have. I actually don't remember. I might have stood up and she sat down there, and I don't remember because this was months ago. But yeah, she bitched a lot that it was her spot. Like today, when I'm watching anatomy and another girl tries to push me out of the way, and she says she needs to film, and I'm like, I don't care, I need to see. And then she said, video. I said, I don't care about your video, I need to see. And that's actually something that really annoys me, is all these students in anatomy class. Professor has a specimen, and they all, not just one, they all come up with their phones and they put it. So say let's say it's a heart. Now sometimes you got like a body, but let's say it's a heart, not the biggest thing. If everybody comes up and puts their phone right in front of it, you know how well you can see that heart? You can't see it. And of course, no one, 10-year-olds know the concept of if you're gonna form a circle, you form it big enough that everyone can be side by side. That way you can all see into the center. No, medical students don't understand that concept. And even if something's very large and they can easily see it from, say, a foot further away, everybody goes as close as they can. And of course, they also got their phones. And if you're not, some reason I have the issue of whenever I don't let someone push past me, or if I push them out of the way, it results in lots of bitching. I guess it's because I don't do that. When people push past me, I'm not someone who's I'm just not like that. The problem is, as I touched on earlier, they have this tactic of complaining the most. And sadly it works. It works in society as well as in medical school, where the more you complain, the more you get. It applies to them getting easier grading, changing test days, and also when they want to push past you, as long as they complain more than you. The sad reality is the professor just wants the student to shut up, so they're gonna want you to, like, what's that word? They want you to appease them. Just let them do it so they'll be quiet. Sad how the world works. And of course, if I were to, like, and it's usually girls. Say a girl goes or pushes and goes right in front of me. If I were to pick her up and go like that, there would be outrage, I'm sure. And of course, I would get in a lot of trouble for physically touching, or however they want to call it. But it's like, she did the same thing by shoving past me. She touched me with her body. How come if I use my hands and I move her, it's so much different? These medical students are very pathetic, but let's get back to summarizing them instead of giving examples. Very emotionally I just get so many examples. You got medical students vomiting before their tests. Not just before exams that really matter, before tests, because they get so nervous. You've got them breaking down crying in class on a semi-regular basis. And like I said, very aggressive, always fighting and arguing. Sadly, we don't live in a society nowadays where I can just be like, shut the fuck up. And sadly, not the point of this video, but these are like I know there's worse people. And it's a societal problem, not just a med student problem, but they're like the pinnacle of this problem. Just very not well-rounded, emotionally underdeveloped, stressed out, anxious, struggling people. And it's ironically because they choose to do this path in life, which they're not suited for. They're suited for something else entirely different. I don't know what it is, but they're not suited for medicine. You know how I can say that with absolute certainty? Because if you're if you're literally having mental, emotional breakdowns and sacrificing your health to be able to get through medical school, it's not for you. Yes, you can manage to do it. Doesn't mean you should. So what's these people's lives like? I mean, it's not too complicated. I pretty much already told you. There is no life. They go to class, they eat garbage, they come home, they eat garbage, and they don't walk home, even if it only takes 20 minutes, by the way. They take metro, or taxi, or whatever. And then they study. And I'm sure they waste time watching some stupid TV. I mean, everyone needs to relax. But all they do is they just repeat until they can recite it back. Doesn't matter if they don't understand a thing. Oh, that brings me to another thing. Here in Belarus, there's a tradition of verbal testing. Now, it's not impossibly hard, and you can simply remember how to recite back stuff for a verbal exam. Now, the idea of a verbal exam is that you ask more dynamic questions, not simply specific types of questions that you can memorize ahead of time. That hasn't really been done, but before these students realized that they weren't going to be the most dynamic in the questions, man, they did a lot of complaining. And when professors were more dynamic, I forgot that there was a professor that was a bit more dynamic at first. Lots of complaining and claiming that it's unfair, it's like immoral, it's not right. How it's not that we don't know the stuff, it's just we study how to do multiple choice questions. We don't study how to answer the question if we don't have it in front of us. You realize what that means? That means they've learned how to guess the correct answer when given the answers all in front of them. They don't know this stuff. They can't even, like, sometimes they do remember, like, they literally just remember, they can recite back to you. But generally, they've tried to remember so much stuff that they can't even recite it back, and they can just pick, like, multiple choice questions. Now, final exams aren't like that, but generally by the final exam, they've remembered how to recite enough of it back. Yeah, back to how their lives are. They don't do anything. These are incredibly cut off people from the world. You should never take the doctor's opinion on anything, and not even medicine, ironically, but certainly not anything other than medicine. Now, I would not take their opinion on medicine, but that's me. I happen to be around them, have a lot of experience with going to doctors. I know that they're not really the best. But certainly you don't want their opinion on anything about the world or any topic other than medicine, because they don't do anything. You can't know anything about anything if all you do is read your stuff for school and watch TV shows. I guess you can kind of learn some stuff from TV. But yeah, that's not a whole lot of good quality learning about anything. These people don't have hobbies, they don't play sports, they don't go for walks, they don't do anything. Crazy. Like, really, it's so crazy. And it all comes down to really one thing. People who are not meant to work as doctors or go through medical school, people who have no interest in science or the human body, deciding that I want to work as a doctor. That seems like a good job to me. They make good money, and it seems kind of interesting, so I'm going to work as a doctor. And then they sacrifice their life in order to be able to get through university and medical school and later work as a doctor. And then it's no wonder why when you go to the doctor, you get really shitty service, and on top of that, you don't get any results. Two separate things, by the way. Generally, the doctors have often the doctors have really bad personalities, and on top of that, you don't get any results. Sadly. Now, not just to toot my own horn and be like a narcissist, arrogant person, but let's examine how I am, since I'm talking so much about how other medical students are, and I'm talking as if I'm different. Well, I'll let you be the judge of that. I go to the gym, to lift weights, 5 days a week. Oh, that's not an intelligent act. Think of it what you will. It actually does take a lot of intelligence. If you think it's so easy to build muscle, give it a try. There's a reason most people don't have big muscles. I mean, the main thing is they don't have the dedication, but it also does take intelligence, because you have to be able to connect with your own body in order to elicit a response that's going to grow your muscles and not simply train your nervous system to move the weight. A big difference between building strength and building muscles. There's an overlap, but they're very different things. But also most people, they don't have the determination, the willpower, and the dedication. But all that stuff aside, I spend the time to go to the gym 5 days a week, and at least it's an interest I have and something I enjoy, something that adds to my overall health. I also go boxing or wrestling 3, maybe 4 days a week. Takes a lot of time. I have to commute 40 minutes there, 40 minutes back. Something other medical students would never dream of doing. Good skills to know. Healthy, unless you get injured. But it's just another aspect of me as a person. I work out, I wrestle, I box, I walk around. I read medical studies every day. Now might come as a shock, like, what do you mean? You read me reads medical studies every day. I mean, I actually have a big enough interest in medicine that whenever I'm thinking about things, I want to see what information is out there. And by the way, the only things we know are the results of experiments. That's something a lot of people haven't caught on to. They think that there's just this body of, the body of knowledge is their experimental results. But most people haven't grasped the fact that all the stuff we know is the results of experiments, and you only know what the experiment tells you. Theories are great and all, but at the end of the day, you only know what you've been told by experiments. Everything else is just fantasy. It may turn out to have weight in reality, it may not. Who knows? All you know is what the experiments tell you. And you can use the theories to design experiments and gather more information. But until you've actually done an experiment, you don't know anything based on a theory. Also, not the topic of this video, but it's not just about reading the conclusion of somebody else about an experiment. It's about reading the whole experiment and what they did, like all the details of what they did, and all the details of what happened, and drawing your own conclusions from that. Not just reading somebody else's conclusion. Because they might have, you don't know, like two people can see the same thing happen and they're going to come to completely different conclusions. So yeah, I'm not saying that I'm like Mr. Does Everything in the whole world, but at least I'm doing something. At least, did bodybuilding competition. So yeah, I work out, I'm a pro bodybuilder, learning to box, practicing wrestling, walking around to stay healthy, doing activities with my wife. I do a lot more than the other medical students. And my overall health, I've had a lot of health problems in the past that were out of my control. And that's not the point of this, but the other medical students, they literally do nothing. Like I said, they can't even burden themselves with walking for 20 minutes each day. That's insane. These are people that are supposed to be health experts. I know that theoretically you can be an expert on something and not do it at all. But if you really were so knowledgeable about health, you would be compelled to do at least some little things to look after your own health. So I'm going to wrap this up because I got to get to sleep. It's been a long video, it's late at night. These people are stressed because they're forcing themselves to do something they shouldn't be doing. And I'll get back to me. For me, how am I able to do all this stuff? How am I able to go to the gym almost every day, commute 40 minutes and box, and commute 40 minutes back on top of all my classes and studying and the extra classes that me and two other students have to do? Well, largely it's because I've already learned a lot of medicine throughout my life due to self-interest. And partially it's because I'm a lot more intelligent than them. And when you have an interest in something, you manage to remember it because you actually think about it and integrate it into your overall understanding of things rather than just try to remember it like I would remember Chinese not knowing Chinese. If you know a language, it's much easier to remember how to say something than if you don't know the language at all and you're just trying to remember it. That's a great way to put it. So these medical students, they're on edge, they're stressed, depressed, always looking out for themselves and screwing over everybody else left and right. friends with someone one day, screwing them over the next day. I don't know what kind of hand symbol could imitate that. Emotionally underdeveloped, having mental and emotional breakdowns, and just not well-rounded people. What's funny is, like, in undergrad, like when you're at your first university, this is very much the case there as well. But some students, they become well-rounded by doing more school activities. Isn't that a great way to become more well-rounded? By doing more of the one thing you already do. Now, sometimes they get creative and they might work as like a front desk person at a medical clinic, because that brings a lot of life experience. Now, of course, that's better than not doing anything, but it's not exactly the most valuable life experience. Now, it is experience, and I certainly would value that infinitely over doing nothing, but you compare that to doing something significant, like having a natural interest in medicine, so every single person you ever meet, you're kind of like interviewing them and extracting any data you possibly can about the human body. Not to sound like a creep, but that's what I do. I mean, I'm a scientist and a doctor without a license, and you can bet that every person I meet, I'm taking every bit of data I can out of them. Because what better way to gather data than every single person you ever meet, you gather data from them. Like, how could you not do that if you're actually interested in this stuff? How could you know people that get sick and you don't like interview them about all this, everything that's going on in their body, and then interview them about the medications they're taking, how they're interacting? Like, you want to gather as much data as you possibly can. It's just your natural urge if you actually have an interest in this. And if you actually have an interest, anytime a thought comes through your mind that you're not sure about, you look for studies that have been done that could give you information to confirm or deny your thoughts. Because why should you just have thoughts and wonder about them when you can actually look to see if there's data that can confirm or reject it? But that's not how most people are, not how most medical students are. Yeah. We're all screwed if we go to the doctor. Luckily, most of the time, we're screwed. Luckily, there are some actual doctors, not just people that should not be working as doctors. Seems like, I don't know if I'm correct, but it seems like the people that are more meant to work as doctors end up working in the emergency room. Ironically, that's where I would like to work, because you actually have to have results, not just screw around, because if you just screw around, the person's dead. So it's pretty easy to see whether you're incompetent or competent based on all your patients are dead or all your patients are alive. Whereas other stuff, it's just like, screw around, the patient's life is going like this. But it doesn't matter because, I don't know how they figure it doesn't matter. Hope you like this video. Please like, subscribe, and comment. Check out my other videos. Sorry that it's a depressing subject, but now you got a little bit more of insight into what your doctors were like when they were younger. Not what you were hoping for. Come to me. You'll get a doctor who's not an imbecile. I've got a website, andrewhutchings.org, where you can hire me for consultations on training, on diet, supplements, the special supplements, which I don't use actually. I'm a natural bodybuilder. You don't need drugs to be in good shape. Well, I know I might not look that big on camera right now, but I'm actually pretty big. I've got a book on and you cannot hire me for medical advice because I don't currently have a license, but it's not advice if I don't